The case study presented follows a 60-year-old man who was admitted to the ER presenting with persistent right side chest pain and cough. The pain had been present for the last month, associated with a cough that was productive of yellow septum without any blood. He had lost 30 pounds over the last 6 months and has had night sweats. He denied fevers, chills, diarrhea, and vomiting. He also denied coming in contact with anyone that was sick or any travel history. He recalls being exposed to TB as a child. The patient smoked 1 pack of cigarettes daily and has been doing that for the past 50 years, and he denied any recreational drug use. He drinks 12 beers daily and has had delirium, right-sided rib fractures, and wrist fractures as a result of alcohol consumption. He had worked in the steel mills but had retired a few years previously. He collected coins and he cleaned them with mercury. Besides daily multivitamins, he's on no medications. He was admitted to the ICU because he appeared dysphenic, tachycardic, and confused. He was unable to complete sentences. His blood pressure was 125/71. Heart rate was 122 a minute. Temperature was 100 degrees Fahrenheit. Respiratory rate was 33 breaths a minute, and oxygen saturation was 77% on room air. He was put on a Venturi mask at 40%, which brought his oxygen saturation to 92%. He had diminished sounds in his right upper lobe. Florence theory can be used to predict outcomes for this patient due to the environment being important for this case. The patient not only has a history of smoking and alcohol abuse, but he used to work in the mines and handles mercury when he cleans his coins, which could have impacted the function of his lungs. Florence teaches of the importance of having clean air and a clean environment. Because this patient has also suffered injuries from his alcohol abuse, he may not have the best home environment to promote a healthy and safe lifestyle. This patient also acquired community-acquired pneumonia. This is one of the most infectious diseases and is spread through sneezing, coughs, and contact. The patient denies encountering anybody that's sick, but because of his history, we need to look at his hygiene. Nightingale implemented hand washing and hygiene practices in the war hospitals to reduce infections. We can predict that if we implement hand washing and hygiene for this patient, it could have been a change that may have prevented the spread of the ammonia and can help him in his progress. Since this patient is also suffering from acute respiratory failure, he was put on a 40% Venturi mask, which is about 10 liters a minute. It's important that the oxygen in the mask is humidified and warm to prevent drying out of the mucous membranes. Flores believed in the cleanliness and ventilation of the air in the room, as well as a stable temperature. We can predict that these extra steps may help prevent the patient from declining in status and acquiring any other infections. We can predict that it will promote healing as well. By taking a proactive approach, nurses can initiate preventative actions to decrease hazards before they manifest as diseases. One of Nightingale's 13 canons included reducing noise. This patient needs rest in order to promote healing. She also believed that rooms and hospitals should be kept clean as possible to prevent spread of infection. Nightingale noted, unnecessary noise is the most cruel abuse of care which can be inflicted on either the sick or well. Nightingale believed that cleanliness of the room and hospital was directly related to disease and the outcome of the patients. The physical environment also had an impact on the patient's psychological health. We can predict that if we allow this patient to rest undisturbed, keep the room temperature stable, make sure the room is clean, it will promote a healthy environment for the patient to progress.